Welcome to this eighth edition of the Breakfast of Clusters4Health. Today we're going to focus on financing translational medical research and innovation. So welcome everyone, and thank you for joining us. If you could move to the next slide, Joanna. So this morning we will hear from 5 different speakers with different perspectives on the same challenge, which is how we can really strengthen medical research and innovation in Ukraine and facilitate access to market of innovative solutions for the benefit of the patients. We will particularly focus on how better financing, investment readiness, and strong ecosystem can facilitate that. But before we hear from our speakers, I would like to say a few words about the project that brings us here today. So the project, Clusters4Health, is a consortium of 8 partners from 6 different countries that you can see on the map here. It's funded by the European Single Market COSME program. And the aim of this consortium is really to work together to support Ukraine healthcare sector. If you go to the next slide. So at the core of the project are clusters, and the idea of clusters being really a powerful engine for innovation and resilience in healthcare. So in practice, that means helping to foster collaboration across the different members of the ecosystem, whether it's companies, university, or healthcare providers. In our cluster, we have patient associations, for instance. It means helping to accelerate transfer of knowledge and technologies, supporting SMEs to get access to funding, to help them scale and internationalize. And we hope ultimately that building this strong cluster organization can support Ukraine to rebuild its industry and its healthcare ecosystem. If you go to the next slide. So the Clusters4Health projects aims to strengthen both the resilience and the competitiveness of the healthcare sector in Ukraine. Support also, like within mind, the integration of Ukraine to Europe, support Ukraine's integration into the single market, bringing them to the European standards, but also establish really strong collaborations with European partners, whether it's member state or the associated countries. So promote that cross-border collaboration and the adoption of innovation technologies in healthcare. So that brings me to the topic of today that I already mentioned, financing translational medical research and innovation. And how financing and other aspects can help to strengthen that. If we go to the speakers, we have 5 experts today joining us with all different perspectives. So some are really already part of innovation ecosystem. Some have experience as funders of startups or more senior positions as well in bigger companies. And we have also translational and clinical researchers. So the first speakers today will be Irina Bistrova. So Irina, you are Associated Professor in Economics and Head of the Ukrainian Future Business Incubator. So the incubator is an initiative part of the Junior Academy of Science of Ukraine under the auspice of UNESCO. I think it's been established together with some Finnish partners, but you will tell us more. And the goal of your incubator is to support entrepreneurs in turning ideas into financially sustainable startups, which is really spot on for our topic today. And of course, you offer different type of support, whether it's mentoring, co-working space, prototyping facilities. So really, really looking forward to hear about your presentation. Thank you.
I can start, yeah. Okay. First of all, I would like to say that I'm really very pleasure to be with you and present our business incubator. And maybe I will speak in Ukrainian because as I know that many of our guests from Ukraine, so maybe it will be easy to understand about what I will speak. I would like to 1 second, please.
Just switch presentation to the presenter mode,
Okay.
the first one. Thank you.
Okay. I would like to present our business incubator, but as Marin mentioned, our main goal to support business, innovative business, first of all, startups, including medicine and healthcare startups. So in Ukraine, наш бізнес-інкубатор, ми називаємо це місце, де
Our incubator is basically a place where we turn ideas into real life businesses. And as Marin mentioned, our incubator is in the innovations domain full cycle. And when we launched the incubator, at the core of this concept was this idea that we'll be supporting businesses from conception all the way through launching commercially and up to a point where for as long as we can bring value for the startup. So we're not a particularly large incubator, but we're a full cycle one where we can identify the services, we can offer the services, the infrastructure, depending on the stage of the project, depending on the industry or their operating domain or other needs of our residents. We were set up in 2018 as initiated by the Ministry of Education of Ukraine, National Academy of Sciences, Small Academy of Sciences, and we are currently a department of the Small Academy of Sciences National Center. So we are a government-funded organization primarily. However, we try to employ different sources of funding to support our projects. We are located in Kiev, Sevastopolska Square. So if you're ever in Kiev, feel free to drop by. And we are the only business incubator or a technopark, if you will, that is internationally accredited. And this means that we offer a certain level of service. And our mission is to support the innovative businesses. Initially, we did not identify any priority industry. So the goal was to support the businesses from conceptualization and all the way along the process for as long as needed. The focus is on circularity, and the larger goal is to support the country on the way to recovery. And of course, we are looking forward to the end of this war so that we can fully be immersed in these processes and support startups. So, although we fully realize that we cannot do this alone and we cannot generate full value every step of the way working as a silo, that is why we try to connect with other communities and we try to employ the quadruple helix model to foster collaboration with with different communities and to join the respective efforts and support projects that have to do with circular and sustainable economy. And our goal, and we know this probably better than anyone else, that for a project to be successful, you need to be able to introduce it into the community, into the ecosystem, just to show them the way. That is why we try to not just be a part of this community, but also to pave the way, to show the way to the startups. In other words, we facilitate the integration of Ukrainian startups into the national and international communities. So we've been around for 7 years, and we have quite a powerful program portfolio, which is quite versatile. We have something that is pre-incubation, so the very early stages where the idea is being born, and then all the way to acceleration. So businesses that are already functioning but just need to raise the funds to keep growing. And it is safe to say that we have built quite a powerful community of mentors, trainers, consultants, partners that help us with this journey of project development. We have 15, we have 2,000 plus alumni community, and every year we have some 15, maybe 15 plus incubator residents. And one of the services that we offer is to, of course, if the project is ready, and I know that we'll be talking about this as well, is to help raise the funds. And so far, we were able to facilitate over $8 million of direct and indirect funding. So, as I already mentioned, there's no clear specialization. So, first and foremost, it is the medical startups, of course, but it is also innovative youth, different startups, different research and entities to help them transform their idea into a business. And also, we work together with the business support centers to help strengthen our services, our presence in the regions. And this is our portfolio. As I already mentioned, it is quite versatile. But moving on, even though we do not own that much space, but we have a consulting center, education and consulting center. Also, we have a prototyping lab with basic equipment. We have office space that is available. We have training rooms. We have negotiation rooms, lecture halls, and just recently we introduced a library project, a material library project, because from what we have learned, it is the certification, the industry design that can be challenging, because it is not just about the design alone, but also about being able to select the best material, the appropriate material. I will be sharing my presentation with you, so no worries if you miss something as I go, because I appreciate that we are a bit pressed for time. So this is the list of our programs, basically, and we are always open to new partnerships. And besides our own programs, we attempt to be helpful as much as possible with something external, depending on the request of our clients. Our co-working space is available to our youth and academia free of charge, and for businesses that can afford it, they can of course enjoy certain benefits, but there's a price list for that. And we offer unlimited access to our prototyping lab. And besides the basic equipment, well, I mean, of course, it is not a huge list of equipment, but this is what you need at the prototyping stage, and it is available at our incubator. We have support engineers that can help you use the equipment. And then, as I already explained, we have a material library. We have 300 samples of different materials from all over the world. So this was shared by the global material library. So we're building our library, adding Ukrainian materials as well to, among other things, promote Ukrainian manufacturers globally. This is our internal startup, if you will. And of course, another aim in mind is to demonstrate to our Ukrainian startups that we do have Ukrainian materials available that are just as good and just as fitting. So some of our samples and probably one of the hallmark programs that we're implementing is the Radpreneur program. So healthcare projects are engaged here. It is also an acceleration program that offered training sessions, mentoring support, and access to funding. And this is also one of the topics up for discussion today. And we are proud to say that in this year and a half, we were managed to fund 72 businesses, and the total budget was over 650,000 euros.
Але насправді у нас досить великий досвід, і ми з задоволенням готові ділитися і відкриті до партнерства.
So we might not have as much experience, but we're always happy to partner up. Thank you so much.
Thank you, Irina. It's a few points that we need to come back on during the discussion that is especially relevant for the topic today. But before I open for the discussion, we will go to our next speaker, Kirill Onchary. Kirill, you are the founder and CEO of Chekai, a Ukrainian health tech company using AI to screen chronic diseases from retinal photographs. You are a very experienced founder and CEO. You've raised already more than $700,000 in investments. You've been operating in 20 medical institutions across Ukraine. And among other awards and recognitions, you've also received in November 2024 the EIT Health Innostars Awards, becoming the first ever Ukrainian company to receive this recognition. So, Kirill, thank you for joining and sharing your journey with us. Over to you.
Yeah, hello. Thank you for having me here. And yeah, you almost described what we are doing and what we have. So maybe I will share a short pitch to highlight what we are doing a little bit more in details. Do you see my screen?
Yes.
Yes.
Great. So as Marine said, I am CEO and founder of Chekai. What we are doing, we are creating a fully closed digital ecosystem for the patient with a chronic disease. Today, in general, in our world, chronic disease are becoming younger and younger. For example, like diabetes, a few decades ago, we see it as a problem of the elderly people. And now a lot of cases started in the early 30s and even early. But at the same time, population is getting aging, and we're facing a huge gap in the numbers of the medical professionals. So this leads to the two biggest challenges which our healthcare now trying to overcome. It's an overstretching and accessibility. And due to this, people with chronic disease are staying undiagnosed, and it's leading to the disabilities and premature death. And our solution, we designed it to address this particular problem, to enable nurses, junior medical staff, pharmacists in pharmacies to detect chronic disease on the early stage with a very simple, quick, non-invasive test. And then start treatment for the patient as early as it possible. How it's work? We are doing an image of the back part of the eye fundus, and analyzing changes in the vascular system and correlate these changes with different chronic conditions. So that's where our AI magic is happening. And but when we start implementing kits in Ukraine and other countries, what we see that's only detection is not enough. We just finishing a huge research on the more than 2,000 patients, and we see that the more than half of patients doesn't go to the follow-up visit to the doctors, even they have known about complications and their disease. And then we understand that we need to create a fully digital journey for the patient when they can do remote follow-up with professional doctors. And even we are launching very soon this year and a fully closed ecosystem with our partners when after the visit we are providing prescribed medicine to the patient, back to the patient. So in every location, in rural area, whenever where patient is living, they can come through the AI screening, remote consultations, and delivery of medicine. So I hope that by the end of the year, this whole closed loop will work in Ukraine soon. So as I said, our customers and our targeting audience, it's in pharmacies and primary care. And so we are moving to the community-based healthcare. It's what is going on in the real world and what is now the main trend of the healthcare system. And we are enabling them to have a digital tools for the early detection and management of chronic disease. So just yesterday we get a registration in UK finally, and now we preparing to launch first pilots there. We are launching this month in last month in June in Uzbekistan, and we are present in the several countries around the Europe. So we are scaling, and our goal to enable access to the healthcare for every people around the world. Uh, yeah, so about awards, Marine said about the EIT awards. This year we was named the best health tech startup in East Europe by Global Startup Award. And we have a lot of recognitions from the other medical and non-medical competitions and agreements. And in December, we was our common project with Roche was named the best AI implementation of the year in the pharma industry. Uh, yeah, I will be happy to answer later on your questions. So let's go to discuss. And feel free to contact me if you have any questions or want to discuss any innovation in healthcare.
Thank you, Cyril. We will really want to dig more into how you manage this success story and especially on the investment and financing side of your company. But before we get there, we will now move to an example more on the research and clinical side. So the next speaker is Lyubov Slepova. Lyubov, you are medical director of the All Ukraine Center for Motherhood and Childhood under the National Academy of Medical Sciences of Ukraine. So the center is an institution providing specialized care for mothers and children. And when we discussed, you told me like we are getting all the difficult cases, and I think you will give some example of that. And Lyubov, you will also be joined by Anna Krebenichenko. Sorry for the mispronunciation. Anna, you are Chief of Prenatal Medicine at the same institution. You lead work in fetal medicine and prenatal diagnostics, and you bring a clinical research perspective on translating specialized maternal and fetal care into practice. So we are looking forward to your presentation. The floor is yours. We can't hear you, so you might have to unmute yourself.
Good morning. We are very grateful for the opportunity to present our work. Here is Lyubov Slepova. She is with me, but she has delegated to present our center. On this slide, you can see how huge our institution is. We have 3 very big buildings. They have been built in 1980s. They are quite big, but unfortunately not very new anymore. We have our general director, Yurian Tipkin, and our medical director, Slepova. Please, next slide. Oh, thank you. So we are a state institution. We are financed from state budget, and we provide medical and medical care to our patients and scientific research in field of pediatrics, obstetrics, and gynecology. We are specialized tertiary center, and we provide medical care to women and children from all regions of Ukraine. And our patients are the most difficult patients who cannot be cared at their local medical centers. And our research projects are guided mainly by our patients' problems. To our patients belong pregnant with congenital heart disease, with hypertension, diabetes, lung, kidney, liver, anything. As well as pregnant women with malignant tumors. We have women with very severe obstetric complications sent to us, very specific field, very difficult patients. These are pregnant women whose fetuses, whose future babies have congenital anomalies, and we care about them. And after delivery, we are cared about newborns and children with these congenital anomalies. Our patients are children with perinatal complications and with severe liver, lung, and other pathology. We are a very big institution, and our patient flow is rather big, but unfortunately, as I mentioned before, we have very dated infrastructure from 20th century, and it makes a lot of difficulties for us as for medical care as well and for research as well. Our center carries out applied and fundamental research in the field of maternal neonatal health, children's health, women's health, and scientific activities also financed by Ukrainian state budget via Ukrainian National Academy of Science. And we also getting some grants. And unfortunately, in our current situation, research and education are underfunded and performed in dated environment and with dated equipment. And the big problem is that our international scientific collaboration is rather lagging behind, and our integration into international community is quite slow. Marine has kindly suggested to give a few real examples of what we do. I'm sorry, I will present the projects which was carried out with our department with pediatric surgeons. So our patients are pregnant women with anomalies of the fetus and their babies after birth. And they need a lot of medical care, of course, very vast prenatal imaging and assessing and monitoring. Then the women themselves get obstetric care, they are monitored, and they are delivered in our center. And then after birth, the children, the neonates, they get preoperative, massive preoperative evaluation and being prepared for the surgery. Then there is a huge, very complicated stage is surgical correction and immediate post-surgery care. And after this, these babies often need long-term follow-up and care. So one of the examples is gastroschisis, is a very specific pathology with when the baby's bowel eventuates through the open defect of abdominal wall. And by the end of the pregnancy, the state of the intestine can worsen. It can have as well some associated pathology that can manifest by the end of the pregnancy. And we need to assess this situation and differentiate from one another. And the research made in our department together with pediatric surgeons allowed us to develop some methodology and some prenatal markers for such an evaluation. And then another very complicated pathology is diaphragmatic hernia. This is a defect in a diaphragm when abdominal organs go up into the thorax, and this leads to lung compression and lung hypoplasia. And prognosis in such situation can be from excellent to lethal when no surgery in the world will help these children. And at early stage, it is very difficult to differentiate these situations. So we put our research and effort there. And we have developed some methodology for such systemic evaluation and developed some science, prenatal science and markers, how to differentiate and assess such complicated pathology. And all this effort, of course, this is not for science itself, but as a result, we could better evaluate such patients prenatally. Next slide, please. So better evaluation is better clinical management, better clinical results. And now in our clinic, our surgeons have achieved a very low complication rate, a very high survival rate, which are at the level of European centers. So, of course, when some research is ended, we see already what can be looked into later on. So we have some thoughts, some perspectives. But when we present our data on international congress or when we go to such congresses for our own expertise, we see that they are aligned with what people are doing all over the world. But and we would like to cooperate our efforts to be a part of this international research community. And unfortunately, with this, we have problems. So we need guidance how to find such projects, how to apply, how to carry out, and of course, how to search for funding. Our medical director, Lyubov Slepova, she puts a lot of effort into looking for alternative funding, and she has, due to her effort, quite a few renovation projects have been carried out. This is the example. This is post-surgery intensive care unit. You see, it looks absolutely stunning and beautiful, and some other projects are in progress as well. And as I told you, our clinical facilities and our research facilities, they are very much interrelated. So you cannot split one from another. So just to sum up, we are looking for some guidance, for some to understand how to search and how to apply to funding to solve our infrastructural problems for both clinical and research facilities, and to organize scientific cooperation with the world. And of course, we would love to, for our staff, for our colleagues, to go abroad to see how the colleagues work and to be a part of the community.
Thank you. Thank you, Anna and Lyubov.
Thank you for your attention.
Yeah, we will come back to some of this point that you listed at the end, and I'm pretty sure, like with Natalia in the room, Tatiana, Irina, you have strong ecosystem here that can support some of these aspects. But before we move on to the discussion, we will welcome our last speaker, Hank Hughes. So, Hank, you told me 45 years of experience in life sciences, which makes it a bit challenging for me to introduce you just in less than a minute. So you have spent your career at the intersection of science and businesses, kind of holding several senior roles both in Europe and in Asia. Relevant to our audience today, you have been the managing director of Flanders Bio for 4 years. Before it became BioVia. And there you've helped to transform the Biotech Association into a broader life science clusters that now counts more than 350 members. You have also founded the Health Tech Investors Summit, the first European conference connecting health tech startups and scale-ups with investors and mentors. I'm sure you will tell us more about that. The floor is yours, Hank.
Thank you very much, Maureen, and thank you for the opportunity to be with you here all today. And also thank you, Tatiana, for the introduction. We had a very nice interaction in Sofia a few weeks ago. In the interest of time, I'm going to focus what I would like to talk about on exactly on the Health Tech Investors Summit, which is a conference that we started to organize 4 years ago, and where the goal is to bring together innovators in health tech from across Europe and investors from across Europe and let them interact with each other. Of course, with the ultimate goal for as many innovative health tech projects as possible to be financed. We are organizing in, as you can see, 30th of November and 1st and 2nd of December this year in Bruges, Belgium, the 4th edition of the Health Tech Investor Summit. And just to give you some numbers, last year we had 95 companies that were pitching at the conference from 20 different countries. We had 27 nationalities represented with close to 500 attendees to the conference. And we had more than 100 investors that were present. And the investors are spread over 3 different maturity of companies that we are welcoming at the conference. So we have what we call pre-seed companies, so companies that are still in a very early stage of development. In some instances, some of these companies are even not incorporated yet, so they are still really in a sort of in a pre-incubation state. Then the second group is startup companies who have already been created, who have raised a little bit of money, and who have a clear product that they have defined already. And then for companies like Czechai, who are already commercializing their technology outside of their home country, we call those companies scale-up companies. And as you can see, we have more or less an even repartition between the 3 subgroups. And we have investors that are addressing these different phases. So we have investors that are more focused on pre-seeds and early stage startups. And we have investors that are more pan-European and that are investing in later stage startups and scale-ups also. In principle, everybody can apply to the conference on condition that you have activities in Europe, and I mean we consider Ukraine as being part of Europe for sure. And I'm very happy to say that due to the efforts of Tatiana, also that we already have 1 Ukrainian company who has applied in the pre-selections that we are organizing. So we have some national and regional pre-selections that we do with jury members from across Europe that review the companies. And we just opened this week the pan-European pre-selection, where you can in essence apply to come and pitch at the conference. And we work very closely together with what we call knowledge partners. So these are cluster organizations that are operating across Europe. And as you can see, Rifnit Regional Medical Cluster, so the cluster that Tatiana has become a knowledge partner. So for any Ukrainian company that joins, they can already get a 15% discount also on the pitching fee there. So we would very much like to invite you and welcome. And during the discussion, we can go a little bit more in detail on what are things that are important for the investors that are present at the conference to be motivated. I will share this brief presentation with some more background, and I can also share my email address in case people want to have more information and more background on what we're doing.
Thank you, Henk. Actually, I think we should follow up on that suggestion already on what is important for investors to see in pitches and in companies that are approaching them.
Well, I mean, we've seen about 750 companies from across Europe that have been evaluated by the juries that we work with, and we have about 120 people representing investors and experts in the health tech space. And I think there is 3 things that always come back as being very, very important. First of all, do you have the team that can deliver what you promise you will deliver to the investors? I think team is very, very important. The second thing, I think it's extremely important. A lot of companies at the moment that they start to develop a new technology get stuck in the technology ivory tower, and they need to translate as quickly as possible that technology into a concrete product. What is the product that you are going to develop, and who at the end is going to pay for that product? I mean, Kirill was very, very clear in his particular case. His go-to-market strategy is via pharmacists and via primary care doctors. And that brings me to the third point. You need to be extremely clear on your go-to-market strategy. Who, at the end of the day, are you going to engage to pay for your product and and so those are the three things that always come back, and we're always hear from the different judges and the different jury members questions and remarks. And if you have those things clarified in your presentation, then at that point in time, you have already a much more convincing story for the investors.
Thank you, Hank. These are very concrete advice from your side. Irina, if I may go to the first question on the financing mechanism that can support medical innovation in Ukraine. From your side, from an incubator perspective, what have you seen work for companies and what hasn't?
Дякую за запитання.
Thank you so much for your question. Regarding the mechanisms, financing mechanisms, we can all appreciate, I'm sure, that it depends on the stage. There's no one size fits all formula. So if you're at the conception stage, then you need to, well, most likely invest your own resources, at least physically, maybe not so much financially. And in Ukraine, we currently have this privilege where projects are supported at the conception stage. So you can even apply for grants just with your ideas. And it was for a reason that I mentioned the entrepreneurship project. So the very early stage, the idea, the validation, the first prototype, but that was rather unique. But speaking of early stages, what really works with the partners is that we try to have our own innovations fund internally at the facilities of our business incubator, our universities. Kiev School of Economics also, they have similar experience, again, to support the project. And then a bit later, when you are at stage 5, maybe 6, you can then apply for grants nationally, internationally, and you can then start thinking about investors. Because at the earliest stage, it might not even be feasible because your project has no value at this point. So that doesn't come until later. And this is where we can step in as business incubators. So we prepare the projects to actually find the money.
Thank you, Irina. Kirill, do you recognize what both Hank and Irina are saying about getting ready to talk to investors, getting access to funding and investments? What's your own experience with that?
It's a really interesting topic, and I would a little bit reflect on what Irina said because I'm not totally agree with it. The first of all, healthcare is a really hard niche for the investors because you have several challenges in this niche. First of all, for the innovations, the way to market is much longer, especially if you recognize it as a medical device, and this make your life like a nightmare for the startup because before you start to learn from the real world environment, you get a lot of regulation, and you need to keep a lot of procedures, processes, papers, even before you start to trying in the real environment. And this really vice versa what we usually expect from the startups, to be quick, easy, light, adoptive, while you test your hypothesis. But so this make an first steps for the health tech startups not attractive for the investors, because they want to invest in something what can generate revenue. Yeah, they are not philanthropes. They are usually want to get some return on it. Uh, but from the other side, for the health tech startup, is crucial to have investors, especially strategic investors, as early as it possible, just to live this long way and to get some support on the validation stage. And this like in a controversial movement, where you should to balance between you can't go too early, as Irina said, but you can't wait too long, because you can't afford to live without financing and real world data and feedback with your product, and to find balance on this, let's say, equilibrium. It's a really hard thing. So in this case, the ecosystem should help for the startups and for the innovators to find right balance, and to find some key stakeholders who can help startups validate and make any first steps. So, for example, in our examples, we work with some scientific universities which help us to growth on the early stage. We did a lot of product and with the pharma companies, big top 10 pharmas, which help us to implement first products and projects in Ukraine. So our first launch was in the end of the 2022, in the Q4 2022, and we start with big pharma in the middle of 2023. So it was very timely when we get support from the big stakeholders, and this allow us to move and to adopt our solution and make it more reliable and more fit to the market. Yeah, like it was mentioned, to find the right fit, and like find right uh, go-to-market strategy, and learn from our potential customers what they want to see in this particular niche, because this is the main challenge.
Thank you. And I think a key, perhaps a link to my next question is this collaboration between partners, between maybe startups and pharmas, but also between, I guess, research and clinic and pharma. And I'm turning towards you, Lyubov and Anna. So there are obviously gaps in funding in your research work. Have you entered some public-private partnership that could support that work? Can you explain a little bit to us what are the gaps and what are your needs?
It's question to me?
No, to Lyubov and
Я буду українською, з вашого дозволу. Вітаю всіх.
Well, in Ukrainian, if I may, hello, everyone, greetings. Well, medicine is quite a conservative industry, and it can be quite challenging to introduce any dramatically innovative solutions. Our center treats children and women, but it's not just the treatment that we offer, just routine treatment. We treat severe pathologies. So patients who weren't able to get the treatment locally. So the research part of our center Of course, we look for ways to address chronic illnesses, and we were quite curious to hear from Kirill today about diagnosing chronic pathologies, including remotely. This is something that we could use, so we will make sure to keep in touch with Kirill, because we have many patients with chronic conditions, the bowel, anything that has to do with rheumatitis and issues that conditions that children have, congenital, and then later on in their lives. And this tool would give us an idea to intervene and diagnose and prevent disability. But this is just one of our priorities. We do have some valuable ideas, and this meeting today, I believe, to be beneficial for us in terms of helping us meet our potential partners. I would love to hear more from you, Irina Bystrova, because there could be things that are not used in Europe, for example, stem cells. And we would be very curious to discuss the application of this solution. Maybe not for all of the pathologies. And Anna spoke about this pathology that put us on the global map. And we do have our methodologies, we do have our clinical outputs. We publish books, we have them translated into English, and we do have the resources at our clinic. We have the staff who are young, who are open to innovation, who are willing to learn and to help us protect our patients and offer treatment early on to prevent disability in children and in women, of course, as well, because there's definitely so many issues to address, especially with the war that is ongoing. In these 5 years, what we've learned is that we have now more congenital pathologies, way more, and we started to explore this. What is it? There have to be some drivers of fetal death, and it's not just us here in Ukraine, just generally healthcare professionals who deliver help with the delivery, and there's innovations that we could be helpful with and help promote them. We would be happy to register for the summit in Belgium to present our innovative solutions. And thanks to our partners, hopefully we'll be able to launch the rehabilitation department for the children who suffered from this war. And it's a huge challenge, really. It's a huge issue, because in the past, we used to think that it is the teenagers who are affected by stress, and in recent years, as we started looking into it, we can see that children, younger children, they also are affected by the stressors, and they can later on develop something acute that is driven by the stress. And this is something that we should work to prevent, because I am sure you can all appreciate our current context. So we have a lot of ideas, and thank you so much for joining this discussion, for listening. And if there's any ideas on your end, we would be happy to collaborate. So thank you so much. We were in such a hurry to get to this meeting today. While we were en route, the air raid alert was on, and we were so worried to make it in time for this conversation, and we're happy that we did. Thank you so much.
We're very grateful that you could make it, and thanks so much for sharing with us. And you can see in the chat that you have already suggestion from Hank, you have contacts from Irina and Kirill. So I hope the conversation will continue between you after the meeting. And that's a great example of of what innovation ecosystem can provide. It's arenas to meet, it's connection to relevant partners. And perhaps something relevant for you, we had a training module on access to EU funding that Natalia can share with you, with like where to look for funding in health, whether you work in translational research or more on the innovation side. So we just have 2 minutes left. So instead of going through the last questions, I will give the floor to you, to every speaker, perhaps to share maybe one takeaway message with our audience, whether they are clusters or startups or innovators. What, from your experience, from your angle, would you like to share with them regarding this topic of financing, access to funding, and partnerships? Hank, you were the first on my screen. Would you like to start?
Yeah, well, my message is very, very simple. When I look at the successes so far from the Health Tech Investor Summit, I think it is based on really building a pan-European ecosystem where people from 25 different countries can meet each other, and can also meet with investors, but we meet with each other and start to work together. And that's the only way, I think, that at the end of the day, we can remain competitive also on a global basis, and we can continue to build better solution also for European patients across the board. And just to add one thing to Kirill's remark earlier, I fully agree with you, Kirill, that the big challenge that we have with healthcare is that it's a long process, but it's also a very, very complicated value chain where a lot of actors are there, and a lot of actors have different interests that are not always aligned with each other. So, and this is where we are trying to help also with pitch training and with strategic insight sessions to help people to understand faster and better the complexity of the value chain in healthcare. And we need to continue to do that on an across Europe basis.
Thank you, Hank. Kirill, would you like to answer to that, actually?
Yes, thank you, Hank, for mentioning this. And it's a really, I think, biggest challenge in the healthcare to match all stakeholders in the map. And the other big challenges in the healthcare, that's value which you create for the different stakeholders and who is implementing and using solution, it's different. So in our approach in the screening, so the value we generate for the general healthcare system, but users and our customers, it's in a primary care. And to build this bridge between them, it's really tough for the startup, because it should to be done by the healthcare system, but you as a startup can't push it, and this is the other big challenge in the healthcare innovation. So such things as sandboxes, ecosystems, which help to bring everybody together and become a platform for the open dialogue and way how to adopt and how to learn from each other. I think this is a huge from one side huge demand, and from the other side
Kale, you've been cut. Can you still hear us? Okay. So maybe Irina, I don't see you on my screen, but if you are still here, would you like to share a few final takeaways for us? You're building a strong national innovation ecosystem. What's next? What's your takeaway message for us?
Дякую. Дійсно, є у мене
Yes,
певні
thank you so
думки,
much.
та,
I do
які в
have
тому
some
числі
thoughts for
підсилилися після нашої
sure, and
зустрічі.
some of them
Ну,
this meeting
насамперед, це
only
впевненість в тому,
reinforced.
що
First of
широкі
all,
можливості будуть і якісні
I can
можливості тоді,
see
коли у нас
that
буде
opportunities
дійсно
present
потужна
when
сформована
you
екосистема,
have a
причому
powerful
інтегрована національно
ecosystem
в
that
європейську,
is
як мінімум,
nationally
екосистему, тому що я
integrated with
на
the
100%
European one,
погоджуюся і знаю,
at
з нашими
least, and I
колегами ми
agree
проходили
100%, and
шлях
I can see
виведення
that from
медичних
what we've done with
продуктів,
other
пристроїв,
startups is, I
насамперед
mean, the
девайсів, так, у
introduction
нас є
of
такий
medical
досвід
products
на
and devices
європейський ринок. І саме
into the
проблема
European
полягає в
market.
тому,
We
що на
have had
сьогоднішній
some
день, от,
experience
крім тих
with that,
проблем, які вже
and
були
I can see
зазначені,
that
що
besides what
наші
we have
ринки
already
не
listed,
гармонізовані в
we can see that
достатній
our
мірі.
markets are not
Продукти легше
harmonized
розробляти більше
enough,
можливостей по тестуванню,
meaning
по
that there's
сортуванню,
different
по, скажімо,
opportunities in terms of designing
конструюванню, по
products,
побудові архітектури, якщо ми
consulting and
AI
architecture,
будуємо, скажімо, в
say
Фінляндії, в Данії, в Швеції,
it's
у нас
different
є
in
ось
Finland
партнери.
and Sweden and in
Продукт розробляється
Denmark.
для користувачів
We have some
України, і
great
тут
partners, but the product is
неспівпадання
being designed for the Ukrainian
законодавства, так,
users. And
відбувається цей
here
шлях отримання сертифікатів,
is
дозволів.
where
Тому
you have
от
those gaps
моя
in
думка
terms of
полягає в
permits
тому,
and
що
certification,
посилення
etc. So
кластеру екосистеми
my takeaway
української,
message is
європейської, створення
probably that
єдиного
strengthening of the
простору з
European cluster,
зрозумілими,
this
доступними
one cluster for
консультаціями,
Ukraine and
порадами
other
чи
countries of
шляхом
Europe with
пасвей
accessible
розробки продуктів для інтегрованого
consultations,
європейського ринку,
this
виведення
pathway
на
to
ринки
design and
України,
introduce
Європи
products in
з
Ukraine,
чіткими
in Europe,
порадами,
with some
механізмами
clear
і
guidance,
підказками,
clearly
як, куди
defined
рухатися і де
mechanisms, and
можна
maybe some tips on how to move
одержати
forward
партнерів
and where to
на
look for
цьому шляху.
partners on this journey.
That resonates a lot with the missions of our project, so we'll make sure to keep in touch. And then Lyubov and Anna, would you like to also share a few final remarks with us?
Dear Marine, you see, we are speaking bit different languages from some of you, because we are medical doctors, we are physicians, and all those, your business language and startup language, it's kind of I would say that you have seen we need a large scale funding, as Henk has suggested. It's hardly will bring some interest to the financial group, but of course there could be some smaller scale projects, some research projects for concrete ideas, operation, and that will make our process go, starting with small steps and then scaling it up to the larger project and larger results. I would say we need some teaching, some education. So how are these processes are organized in Europe, in Norway? So how the state big research center, university clinics, for instance, that I see that the more similar to us structures where they give medical help and doing some research and education. So we need to know how this process and financing is organized there, so we could speak the same language and understand what we need much better.
Yeah. Thank you. And that's, I guess, very relevant for what you are trying to build also, Natalia and Tatiana, in Ukraine. So thank you so much to the two of you. Tatiana, you have your hand raised. Would you like to, final
Thank you,
word?
Marine. I will talk in Ukraine for our Ukrainian auditory. Я дуже щаслива, що сьогоднішній
I am
сніданок
happy
показав
that
справжню силу
this
кластерів.
breakfast
Саме медичні
helps
кластери,
us
які
see the
з'єднують
real
і
power of
оркеструють екосистему
clusters, of
охорони
medical
здоров'я, ми
clusters that
розбудовуємо в
orchestrate
українському
the
кластерному
healthcare
альянсі.
system
Це
that
така
we're building
парасолькова
with the
організація, яка
Ukrainian
створилася з
Cluster
початку
Alliance, which
повномасштабного
is this
вторгнення в Україну
umbrella
і
organization
об'єднує
that
більше
we set
50
up
кластерів з
after the
різного
full-scale
напрямку.
invasion, over
І
50
в
clusters
ресурсному центрі
from
ми
different
координуємо
avenues.
наші
And at the
медичні
resource
кластери,
cluster,
які
we
існують
coordinate our
в
medical
багатьох вже
clusters
регіонах України.
in
І
many
саме сьогоднішня зустріч
Ukrainian
показала,
regions.
що у нас є різні
And
учасники
I
з
can see from
різних
this meeting today that we bring together
щаблів, які можуть
different
взаємодіяти між собою, як
participants
саме кластери можуть з'єднувати
that
їх,
can
науковців,
collaborate
стартапи,
via the
інвестори, ті,
clusters,
хто підтримує
the
їх на ранніх
researchers
стадіях,
and
ті, хто
startups,
інвестує
and those
в
who support them
більш
at the
зрілі
early
продукти.
stages and then
І
invest
саме
in
оце
something
наш
more
сніданок, мені
mature.
здається, з
And so
усіх,
this
яких у нас
breakfast
був,
today, of
він
all that
є
we have had
показовим
so
саме, як
far,
працюють медичні кластери
is a
в
great way
Європі,
to
як
show
ми
how
хочемо
medical
налагодити цю
clusters work in
співпрацю в
Europe. And
Україні.
this is something that we would
І
like
я
to
дуже
build in
вдячна
Ukraine.
Хенку за
So
довіру,
I am
за можливість
grateful to
рівненському
Hank
члenu медичному
for
кластеру
his
бути
trust and
нашим
for
вашим представником
letting Rivne
Medtech
Cluster
Invest Summit
be the
в
representative
Brugge.
of Medtech
І закликаю
Invest
всіх
Summit in
інноваторів
Brugge. And
зв'язуватись
I
з
would like
нами
to
для того,
encourage
щоб
all of the
отримувати
innovators
ці
to reach
вигоди і
out
знижки
to
для
us to enjoy the
представлення
benefits
своїх інноваційних
and to be
продуктів.
able to pitch
І
your
дуже буду щаслива,
innovations.
якщо ми
And
будемо показувати
I'll
українські
be happy
інновації і розказувати про наші
to
можливості,
have this
про наші потреби
opportunity
всьому
to
світу і всій
present
Європі.
Ukrainian
Дуже
innovations
дякую,
and to
Марін,
tell the
дуже
world
дякую,
and to tell
Джоанна, і
Europe
всім
about
партнерам
our
нашого
innovations.
проекту
Thank you,
Cluster4Health
Marine. Thank
за
you,
таку
Joanna.
можливість
Thank
сьогодні,
you
за таку
to
зустріч.
thank you to all of the
Дякую.
partners for the opportunity to meet like this today. Thank you.
Thank you, everyone. You made my job quite easy by concluding very well this session. So I won't keep you any longer, but I think I have the duty to announce the next session that will be on September 23rd. Here it is. That will be coordinated by our Italian partners, and will address cluster-to-cluster cooperation. So if it's relevant for you, please join us for the next session. And then I think, there was another event. Joanna, do you want to say a few words about that?
It's a brokerage event. You have a link to registration on a chat. So you are welcome to join us. It's an event that you can meet face on face with people that suit to your needs, your offer. So please feel free to join us.
Thank you. And I hope we can all stay in touch also after the breakfast to keep working together and see how we can support medical innovation further, whether it's in Ukraine or in the rest of Europe. So thank you, everyone. Sorry for keeping you over time, and I wish you a very nice day.
Thank you.
Дуже дякую, гарного дня.
Thank you.
Thank you
Thank
very
you.
much.
Thank you.
Bye-bye.
Bye-bye.
Bye bye. See you later.